We're going to now do the left side, and then we will be moving shortly after that to Dr. Rubin's table, where we have Narissa for, I think, Botox and filler in the glabella region.
Okay.
So we might move the cameras over pretty soon.
Okay. So temples again through the numb area.
Any questions from the group here?
Again, staying below the superficial temporal fossa. And then massaging. Anytime I give a large amount, I will massage. How you doing? Okay? Good. Okay. And again, to lift up this brow, we're going to, I don't know if I can do this without on camera, lifting up the skin, being below. Really hard. Not easy to do. Okay, so it's all right. And again, by an easy, simple, I'm not really trying to push this anywhere, and that's how you know you're in the right plane, because of that loose alveolar tissue. The other thing with Sculptra is that with PLA, oftentimes feel is important, just as important as look, because you will sometimes feel along and go, I still feel like I haven't done anything there, even though you can't visually see it. And obviously you're not feeling the actual particles, but you are feeling the lack of hydrogel in that location. And again, even product distribution is important. So I feel like there's a little bit of a loss here, so we're going to march forward. It's okay to use different amounts on different sides of the face if the patient's asymmetric to start with. And I do try to map out every patient before I treat them, and that helps me move along quickly.
So Doug, I just want to ask again, in the temple region, you inject subdermally?
This is below fascia, so below superficial temporal fascia.
So this is very good, because we've had two demonstrations here, one of subdermal by Dr. Wershner and one of subfascial. And I think they both work fine. Do you ever go subdermally, or your approach for the temple region?
In the temple region, I don't, because it's an active muscle area, and I like to sleep at night. And so if I'm going to get a lump or a bump, I want it to actually lift the skin out.
Yeah, okay. So there we are. Two good opinions there. So why don't we have just another minute or two here, and then we're going to move to our next table.
Okay, turn for me a little bit. She's not marked. I left her unmarked just for the purposes of, so you could see on camera. I would actually mark her. You okay?
So one unifying theme we have of the longer-lasting fillers is that they're all injected deeper. You're not going to inject Radius, Sculptra, or the future ones that come out in the superficial dermis, any of them. And also, you tend to stay away from things like lips.
Yes. You can do cutaneous lip. I would use a more dilute solution. A little goes a long way, and I would wait 3 months between treatments.
Yeah, we'll do some other examples of this a little later on, but when injecting the nasolabial fold here, there's that triangle there that we tend to lift up, and it's important to bolster the medial component of that. You put it laterally, and you can be in trouble.
Doug, have you ever injected Sculptra in the neck?
I have not. I think it's just so prone to, active muscle area. It's going to want to sweep the product together, and if you get a lump or bump, you're certainly going to see it. And I think now with the fractionated lasers, we have a lot better treatment options.
Now, we might have to just lift the head forward. Look, can you put your head forward? That's good. Actually, yeah, I think it's fine. So if you could just face the camera so that you're straight on there. A bit more. That's good. Okay, Doug, do you want to take it away and see?
Yeah, I was going to say, even though the nasolabial folds are present, the overall facial, even just this reproportioning, it draws your eyes away from her nasolabial folds and reproportions her face. So this idea of treatment and the elevation of the brows really can add to an overall look of youthfulness. Okay, and how bad was it? Did it hurt? Okay, she has to say that, but no. I can rest.
I'm just going to interrupt you for a second here, just so that people in the audience know. At the end of this session, I will be pulling out one of these little tickets for the free book, so stay tuned.
We have. And so at this point, I would also then massage her with anything, Cetaphil, anything that's nice and slippery.
Do you use Oroderm at all, the vitamin K preparation?
You can use arnica gel, sometimes people use for bruising, just as any slippery substance works as the lubricant.
Yeah.